My name is Jeremy Jones. I'm a interventional pain physician. Traditionally, interventional pain is a separate board certification, typically anesthesiology, physical medicine rehab, and neurology, some psychiatry. But in traditional pain management, we try interventions to try to reduce or completely eliminate the need for pain medications. We do this in a multimodal approach, so it may include physical therapy, it may include an injection as a type of nerve block, sometimes ablation procedures to make the joints less sensitive, and those are some of the interventions that our interventional pain management specialists will do. There are some patients, unfortunately, after back surgery who don't get better, or there are unfortunately some patients, a small percentage, but some patients, they have a complication of surgery or they just don't get better. And then often those patients end up coming back to us, and then we'll do something like spinal cord stimulation to help reduce their pain. It lasting more than 4 weeks, more than 6 weeks. Sometimes patients have a knee replacement, still hurts. They have a hip replacement, it still hurts. They have back surgery and it still hurts. It doesn't have to be all of those things. I mean, sometimes they've just had low back pain that's been nagging for years, and then suddenly it got a lot worse. There's been some very exciting, relatively recent innovations in pain management, specifically in the field of neuromodulation. Neuromodulation has in the past really referred to spinal cord stimulation. And in spinal cord stimulation, you are interrupting the pain signal by passing an electrode to the dorsal column of the spinal cord. And this is usually powered by a pacemaker-like device. More recently, at the last year and a half or so, the FDA has approved dorsal root ganglion stimulation. And in dorsal root ganglion stimulation, you're able to very specifically pinpoint a specific pain pattern by putting the electrode and stimulating the dorsal root ganglion of the nerve root. Inguinal pain after inguinal hernia repair, chronic abdominal pain. It's a very exciting treatment because the success rates in the studies have been, you're getting more the 80 to 90% pain relief as opposed to traditional spinal cord stimulation, where sometimes it's a bit lower. If you're in pain and it's affecting your quality of life, it's keeping you from doing the things that you love to do and taking time away from the ones that you love, and if it's making you need to take medication on a daily basis, any one of those things, you ought to see a board-certified interventional pain specialist, because there are so many therapies out there that weren't available, even 5 years ago. And some of those therapies may help you, regain your life. It might just be clearly identifying the problem so that you can do therapy to fix that problem. Or it might be a nerve block. It might be, in the case of somebody who has a peripheral neuropathy, it might just be finding the right medication. But for most people, there is something out there that will vastly improve the quality of life. And so what I would say is go see an interventional pain specialist.